The most common birth defect for children is congenital heart disease, and 1% of babies are affected by this condition. How do medical care teams care for these children? Our next guest is Jim Thompson, MD and Director of Interventional Cardiology at Johns Hopkins All Children's Hospital. Thanks for being here, Doctor.
Thanks so much for having me today.
Yes, it's a pleasure to talk with you and learn about this. And I feel for parents going through, the mom's going through her pregnancy. You have so many worries, and then to get that diagnosis, okay, your child that is about to be born is one of those that has this particular disease, because it does happen in 1%. Can you kind of walk us through when or why this might happen?
Well, it's the formation of the heart during embryonic life is very complex. It's a wonder that any heart turns out normal, to be honest with you. But fortunately, most of the defects that we encounter are relatively minor, and most don't require much intervention. But some are very complex and require open heart surgery or interventional cardiology, the things that I do. Holes in the heart, blocked valves, leaking valves, and then some kids are born with like half a heart, something called hypoplastic left heart syndrome, and that requires a series of several surgeries.
Wow, so you need the team, like you're doing the operations, you're doing the surgeries, but you need this incredible team to do these different procedures. What happens when a mom is diagnosed, or her baby, I should say, you have this issue? What are the next steps coming into this world?
Yeah, well, so we have fetal cardiologists. Actually, we're diagnosing most of the complex congenital heart disease before babies are even born. And this helps mothers deliver at a hospital where we can care for these kids, like Johns Hopkins All Children's Hospital. And it's a huge multidisciplinary team that helps with these kids. You need great nurses, respiratory therapists, surgeons, cardiologists, ICU doctors, and it takes an anesthesiologist, the entire team, to take care of these complex kids.
I know each case is different, but being as that you see this all the time, what message do you have for the parents when they first find out there's a diagnosis like this? I mean, your reaction is to be overwhelmed with fear. What do you tell them? Because I know so many advancements are being made and have been made.
Sure. Well, again, most kids get better. That's why I love pediatric cardiology. And so we can manage most things very well without much complication. And then the more serious stuff, again, the care team at Johns Hopkins All Children's, we deal with this all the time. We're able to get great outcomes. And as you said, the technology keeps advancing. So every year I'm doing things that I wasn't doing the year before to help these kids.
Speaking of helping these kids, there's a wonderful event coming up, and I know that's why we're here to really get into this, the funds that are being raised and the event itself that's happening soon.
Yes, so Casting for Cardiac Kids, we started that about 4 years ago, where this is our 4th annual fishing tournament. So all pediatric hospitals need philanthropy to take great care of these kids, because there's a lot of things that don't get reimbursed by insurance, and it's very expensive to take care of complex kids. So I learned early in my career that we need philanthropy to help. And so I started this event about 4 years ago. We have a big reception at the James Museum in St. Pete the night before, with silent auction, live auction, a patient story, food and drinks to kind of kick off the event. And then Friday, we have a big fishing tournament that goes out of Tiki Docks, and just inshore fishing. It's a great time.
I love that this is, for lack of a better term, this event is your baby. Yes. Casting for Cardiac Kids is yours. And so you just said, hey, I want to do this. I see this every day in my workplace, and I want to do something to help.
Absolutely. And do something fun while helping. So I love to fish.
That's a great thing to do. Overall, what's one more thing you can share with us in regards to parents, new babies, and that fear of, oh no, they've got this heart condition?
There is hope, and we can help you take care of your baby.
Fantastic. And for more information, we've got the information up for you on the screen. You can take a look. Casting for Cardiac Kids, and you can go to the website to find out all the information. Again, happening April 3rd. Thanks so much for your time today, Doctor.
Thanks again for having me.